Good evening to you. Welcome to this press conference on COVID from Illawarra Court. This evening, we are going to be focusing on policy. In the last few days, there's been a lot of discussion, but this arises out of a major policy statement that Prime Minister Motley gave to the nation in an address yesterday. Today, we are going to be drilling down on some of that policy based on public discussion, the nature of the responses that have taken place, and the fact that the public needs to know and to understand what happens when this country goes on pause. What does it mean to you? What does it mean to the business sector? What does it mean to the individual? That is the kind of conversation that you're going to have this evening with three ministers. Lieutenant Colonel the Honourable Jeffrey Bostic, Minister of Health and Wellness, who will update us on the latest numbers on COVID and some new developments which have taken place within the last 24 hours and which the public should be informed of. Also joining him are the Honourable Carrie Simmons, Minister of Energy, Small Business and Entrepreneurship. There's been a lot of discussion about the small shops and communities, and he is going to focus on that. And finally, Minister of Education, the Honourable Sandra Bradshaw. Somebody has to deal with the logistics. We're told that we're going to be feeding the elderly, looking after the vulnerable during this period of pause. How is it all to be done? And what are the key messages that need to go out for those people who are vulnerable and who are elderly? Minister Bradshaw will discuss this. So we start with Minister Bostic, and we remind you that the key actions which you are to take remain the same. Wear your mask right. Wash your hands often and move away from other people. Stand 6 feet away from people who are not members of your household. That doesn't change, and that's what you need to do every day. So, Minister Bostic, thank you for joining us this evening. Please, what is happening with the numbers and what's happening in the country? What do you want to update us on? We await your message.
Thank you very much, Ambassador Thompson. Good evening, ladies and gentlemen. Testing at the Best dos Santos Public Health Laboratory continues, but the latest figures that I have for you, based on what has been completed so far, we had 363 tests that have been done, of which 34 new positive cases we've been able to determine, which is just under 10% of the tests done have been positive cases. 2 of the 34 positive persons are persons who would have been sent to the Harrison Point Isolation Facility for clinical assessment on a previous occasion. Of the other 32 cases, 28 have been identified as Barbadians, 3 non-Barbadians, 1 unknown, and that is at this point in time until we've been able to do the contact tracing. 23 other persons are being sent to Harrison Point for clinical assessment. Just to give you a comparison, over the last 3 days, we would have done 1,454 tests, of which 76 have been positive, or just over 5%. So you can see exactly what is happening here. We will continue to do the testing that we say we will do. We are focusing on primary contacts at this point in time and persons who present with symptoms until we are ready to launch the new testing initiative. You would recall that we had a case that came from a nursing home, a private nursing home. We've been able to determine that the case did not start there, and because the person would have been there for a minimum period of time, approximately an hour and a half or so, and this one obviously was a challenge or a worry, but fortunately we were able to get on top of this and I can report that all of the residents of the nursing home and all of the staff have done antigen tests and PCR tests that have come back negative, and they're now awaiting the results of the second PCR test so that we can determine where they will go from there. So we are very much on top of this one. But after one challenge comes, another one is on the horizon, and so I have to inform you that during the morning I was told by my staff that we had one positive case at the geriatric hospital on Beckles Road, known by some as the St. Michael District Hospital. As soon as we got that information, we sent the chief medical officer and 2 senior medical officers of health to the institution to be able to speak with the hospital manager as well as the consultant gerontologist, and also to speak to the staff at the hospital. We are on top of this one in the sense that it is one ward of about 16 persons, and then the staff meaning doctors, nurses, and ancillary staff. So far, all of the residents or patients, as well as all of the staff, have done an antigen test, rapid test, and all results are negative. As we speak, the staff, they're going through the swabbing process now for the PCR test, and then the same will happen with the patients or the residents. As soon as we've completed the testing exercise at the hospital, the staff will be taken to a designated quarantine hotel, and the patients will go to the St. Lucie District Hospital where they will receive appropriate care. That is providing that all return with negative results. The situation at the hospital, the service continues to the remaining patients at the hospital by those staff who are there, and we put a plan in place for that to continue, and I'm very satisfied that they will continue to give the very best service that they can, because my visits to the geriatric hospitals always reveal that the staff who work with these elderly patients at the hospitals treat them as if they were their own parents or grandparents, and I'm sure that that is going to continue. So the situation is ongoing. We are on top of it, and as soon as we get any additional information, we'll be happy to share with the public. But to all relatives of those who are at the hospital and those who will be transferred to the St. Lucie District Hospital, rest assured that your relatives are still in good hands and that they will continue to receive the quality of care that we are accustomed to providing.
Thank you so much, Minister. That was very reassuring. This matter, however, did not dominate the call-in programs today or public discussion. In the public domain, the issue was, and what about the small shops? What about the small people? And that is therefore the question that Minister Simmons is going to answer this evening. The Honourable Gary Simmons, Minister of Energy, Small Business and Entrepreneurship. Minister, what about the small shops and the community shops and the small businesses? The public wants to know, and the businesses themselves need guidance.
Thank you very much, Ambassador. Ladies and gentlemen, I want to begin by thanking you for the very large outpouring of comment and expression of concern about these issues with regard to small and micro businesses in Barbados. The reality is that government continues to be very sensitive to this matter. Let us face facts. First of all, whenever there has been anywhere in the world today cause for there to be a shutdown of the economy and economic activity, the reality is that small business and micro business, and by micro business I really mean the single operator, the entrepreneur, the one man, so to speak, out there, There are the people upon whose shoulders the pain of the shutdown financially falls the hardest. And that is simply because they simply do not have the financial wherewithal to cushion them for a long period when there's no access to any clients or to any business. And that is a reality everywhere that you see shutdown across the world. It is no less severe a problem in Barbados. And so therefore we have to be specifically sensitive to the small and micro enterprises in this country. And I want specifically to speak also to the small village shops, the rum shops, the community of vendors in their totality, whether it be itinerant vendors moving from place to place, or those people who are set in one market, or alternatively the food van operators, the operators of delicatessens, etc. Government has listened carefully, and as the Prime Minister indicated when she addressed the nation a couple nights ago, there was a mandate from her to myself to meet with Minister Strawn, the Minister of Maritime Affairs and Blue Economy, and the Minister responsible for Agriculture, with a view to trying to settle a way forward on this matter and to see how best we could advise Cabinet on the type of financial assistance that could be rendered. We met at Cabinet today, and therefore I'm in a position now to speak to you on this in some detail. The first thing I want to do is to invite all shop operators and all vendors across the community of vendors, irrespective of what type of vendor you are, and especially also those people who operate food stalls and food vans and basically who sell food, to reach out to the Ministry of Commerce so that you can register with us. And I would want to urge that this be done almost immediately. I'm going to share with you now the email address that I want to invite you to use. I'm going to repeat it, but let me start the first time. commerce.smallbusiness@barbados.gov.bb. I repeat that again. commerce.smallbusiness, one word, @barbados.gov.bb. Now, that email address is being set up to automatically respond to you and acknowledge the fact that you have sent in the information that I'm going to request of you this evening. The email address will be manned consistently throughout the weekend by members of staff of the Ministry of Energy, Entrepreneurship. And what we are going to do is to be in a position, or put ourselves in a position, where we are able to sift through the types of businesses that are being represented to us on the email, and to be in a position then to forward that information to the Ministry of Finance so that we can, early next week, begin the process of offering people some degree of financial assistance. I want to speak specifically, therefore, now to the type of information that we think we need to get from you from as early as tonight, if possible. Once you have sent your email to commerce.smallbusiness@barbados.gov.bb, we want you to indicate the name of the business if the business has a name. If it does not have a name, just give your name and address as the operator of the business. And then also indicate the type of the business. So the name of the business first, the name and address of the operator if the business doesn't have a name. And even if it does have a name, you can still give us that too. Give us the type of business that you're operating. For example, you have a food van, or for example, you have a rum shop. We want to know the location of the rum shop. So if the business is set one location, like a shop, then you're going to say your shop is at Hoyts Village, St. James, or in Redmond Village, St. Thomas. And then you're going to give us your bank or credit union information, which would be the account that we can deposit money to. Now, before I come to the question of how much money, and I know that is a burning issue, I also want to say this. Cabinet today authorized an adjustment to that which the Prime Minister had indicated with regard to closure of all businesses that were selling food other than the supermarkets. the mini-marts will open only in those parts of Barbados where there is no ease of access to supermarkets. So just to make sure that everybody understands what I'm saying, if you go into St. Joseph, for example, I am told reliably by the Attorney General that there are only 3 mini-marts to be found in St. Joseph, but no supermarket. And therefore, in that set of circumstances, they would be able to open, because you need to be able to give people who come from districts where there is no ease of access to a supermarket an opportunity to access the purchase of food during the same hours as the supermarkets would be open. This, therefore, would logically apply in rural Barbados especially, so that and I don't want to speak out of turn because I do not know the specifics of every parish, but I would imagine St. John, St. Joseph, St. Andrew would be in similar types of situations. To the more specific issue of the financial assistance. With regard to shops, it has been agreed that shops in Barbados would get a financial assistance, and I don't wish to use the word compensation deliberately, because compensation suggests that this has been specifically calculated, or that it is even capable of being specifically calculated. We are trying to intervene because we know that on the last occasion that there was a shutdown in Barbados, the circumstances were that people could go into the communities and use village shops. The reality is that COVID-19 has now spawned new variants. One such variant in Barbados is identified as that which is the United Kingdom variant. We need to be very realistic about what we have seen and learned by way of experience in the United Kingdom. COVID-19 is now killing people over there at the rate of over 1,500 people a day. That variant is highly infectious. It is highly contagious. For those very obvious reasons, in a set of circumstances in Barbados where our population is very dense, we all know this, where people are living in housing units with a very dense population themselves, and in some units there is a density of occupancy of the unit, we have to be very, very careful that we do not allow this disease, especially if it is that particular strain or variant of the disease, to run away in our small communities in Barbados. And so therefore, because of the fact that shops tend also to be liming places, and I will speak to this to some extent afterwards, we are doing our best, as the Prime Minister says, to have a set of circumstances for 2 weeks where people reduce their footprint and they are not going to be encouraged in any way, shape, or form to be moving about the district that they live in, even if only on the pretext of going just down the road to get something from the shop, which can often also turn out to be a 10-minute line by the side of the shop. Shops will be getting $750 a week, so that for the period of 2 weeks, that will be $1,500. With regard to vendors, we have settled on $250 for vendors, and so for the period of 2 weeks, that would be $500. Let me also say that this is an attempt also to not just pull it from the sky, but to try to bring some alignment with the adopt a family type of assistance, where families in Barbados are given assistance from government as well. I want to add that it is not limited only to shops and vendors, but the assistance that we're working out will also be to the following categories of persons: people who are operating beauty salons, people who are barbers, nail technicians, water sports operators, taxi operators as well. Let me enter this warning, however, with regard to the taxi operators. We have to meet with the transport sector as a whole in order to make sure that we are not putting ourselves in a position where people will subsequently come and say that the government gave away the public's money. We need to be sure that people who are licensed as an operator still in fact operate, and therefore there is a need for us to apply a measure of caution not only with regard to taxi operators, but with regard to all other sectors who we're trying to assist as well. Now, if you think it through, how then do we know that you are a shopkeeper? We tend to know that you are a shopkeeper because you should not be operating without a liquor license. So therefore, I know now that there are 1,444 liquor licenses of a retail nature which would satisfy the requirement for us to be able to speak sensibly to that category of people we are talking about. I know that there are 1,500 vendors approximately who are registered either with the Barbados Association of Vendors, or they are registered under the jurisdiction of the Supervisor of Markets of the Ministry of Agriculture, or alternatively, they're registered to do their vending with the National Conservation Commission, where there would be beach vendors, so that we can again speak with some measure of certainty to that community of people we're speaking to. Equally, we are aware that there are some people, especially since the last shutdown, who are in a set of circumstances where, because their business or the business they were working in before never reopened, and you have to find a way to earn a living, so they set up a little thing alongside the highway. You were not vending before, but you are vending now, and you have been vending since about April or May of last year. And we have to try to find a way of working with those folks as well. And so therefore, an approach is being worked through where we will have the necessary meetings with that aspect of the community in order to try as best as is possible. And I say upfront, it is an imperfect system. It is a very imperfect system. But what we're trying to do is to try to meet people part way. And where there is a failure on the part of government to be able to respond in a manner that you consider to be adequate, and you feel that you are hurting sufficiently that you need to reach out, then a call center will be created, and we will notify you of this early in next week. I believe Minister Bradshaw will have some specifics on that, so that you will be invited to call in and to try to raise your concerns so that you can be directed to the type of intervention that we may be able to offer you as best as possible in the circumstances. In addition to that, vegetable farmers are also a group that we are going to be working with, not necessarily in the context, however, of providing a financial package of assistance, but more to connect them to opportunities to sell to the government of Barbados, because we want to build out a set of care packages. There are a number of homes across the island that are going to be under severe stress over the course of the next 2 weeks. We are conscious of this, and again, we want to have the necessary care packages which act as a social safety net, because what we cannot do is to afford to hear that people went hungry during this period of lockdown. Ladies and gentlemen, I said that I would speak very briefly again to the question of shops, because I have been listening to the call-in programs. I have been following the social media platforms. I know what the concern is, and I feel it. I understand it well. But a shop is really a community of comfort. And if we're true to ourselves about the Barbados we live in, we know this to be a fact. The shop is where the fellas go and lime. I, for example, may have a shop in my district that is run by a lady, let us call her Pearl. And Pearl was my girlfriend 10 years ago. I may have a child from Pearl. Even though me and Pearl are no longer together, I feel I could go by Pearl's shop and relax and put up my foot and call for what I want, and maybe even trust what I want, and take off my mask because I'm comfortable at home at me. Pearl no longer dealing with me. She got a fella named Fred. But Fred feel he could go at the shop and do the same thing, and properly so, more so than me, because he is the boyfriend now. And he goes and put up his foot and take off his mask, and he could lime. And the fellas who play dominoes in the shop every Wednesday feel the same way, because they are there every single week on Wednesday night playing dominoes and giving Pearl business. They feel that they could go at the shop and relax and go into this comfort zone where they take off the mask and you lime. And the gentleman who captained the cricket team and goes there on a Saturday after cricket does the same thing. But COVID doesn't care about the captain of the cricket team or the fact that I used to date Pearl, or the fact that Pearl got a new boyfriend. COVID doesn't care about them things. All COVID cares about is that it is a virus, and a virus must have a human body to act in as a host. And once I am at that shop rather than at my house, then that virus has an opportunity through me to move to the other person in the shop for that person to become a host so that the virus can replicate itself. And in this tightly knit community and in these small villages in Barbados, that opportunity for replication of virus is phenomenal and exceptionally, exceedingly dangerous. And that is why government is trying to do its best to stamp out the opportunity for that replication of virus to take place. It is not because anybody is hard-hearted. It is not because anybody is spiteful or indifferent or uncaring. It simply is that we have to take this tough measure now and give this our best shot for the next 2 weeks. Otherwise, then when we look at what this same virus with the same strain has caused in other parts of the world, we're looking at a set of circumstances, ladies and gentlemen, where we are talking about mass graves. As I said, 1,500 plus people being buried every day in England. In the situation in Brazil where mass graves, you don't even get a proper funeral. They just put you in a hole and cover you over with 50 or 60 other people. That can't work. And so therefore, this is a tough one. It really is a tough one. We're asking all of the business grouping sectors that I mentioned before to register with us during the course of the next few days. Let us verify that you are authentic. And as I said to you, there are ways and means of us knowing. I know you can't sell food as a business legitimately if you have not gotten the necessary permission from Minister Bostick's ministry. So we know that if you're coming to say that you are a vendor of food, you should have your license. Those are the ways in which we will check and cross-check and try to verify. But we genuinely want to reach out to as many categories of small entrepreneurs as possible to help provide that safety net through this period of time. I thank you for your attention.
Thank you so very much, Minister, for the exposition on the new policy and elements of it during the upcoming pause. We are equally grateful for the explanation on social dynamics in Barbados. And I just want to assure any shopkeepers called Pearl or Pearly that the minister was not specifically speaking to you, nor does he know any Freds. But I think that in terms of how we behave in Barbados and what the minister referred to as the community of comfort that we take from the community shops and the way we interact with one another, whom we know well, Minister Bostick has said it before, this is where we let our guard down and we mustn't. So the decision is anchored in protecting our people. Another component of protecting our people and caring for the community is seen in the level of support and the nature of the support given to the poor, the vulnerable, the elderly, and those who are severely challenged during these periods of lockdown, as some people call them, or pause, as the Prime Minister has now referred to the upcoming period. But the government on the last occasion provided some $60 million in support for individuals and for various sectors. The government provided and adopt a family program for those who most needed help. And indeed, there has been a continuing program to give care packages and hampers and other support to vulnerable families in Barbados. But when policy is rolled out, when policy is developed, implementation and good implementation is critical or the policy flounders. Dealing with the logistics is Minister the Honourable Sandhya Bradshaw, who will now explain to us some of how this policy is to be implemented. And I'm saying some because clearly there are many components to the new policy and you have to understand it all. And over the course of the next few days, a number of ministers and guests will be here to explain it to you. But this evening, shooting us off at the beginning is Minister Bradshaw. Minister?
Thank you, Ambassador. Good evening, Barbados. Let me first remind all of you that all of us as representatives in the government of Barbados knew when we came to public life that there were people who were below the threshold and living below the threshold. There were vulnerable people in our society that we all were committed to trying to assist. COVID has perhaps plagued all of us with an even more difficult situation as we try to grapple with all of the challenges that are confronting us in this country. And while, as Ambassador Thompson has indicated, we have put a number of measures in place to be able to ensure that persons who fall below that threshold and who are most vulnerable in our society are able to access assistance. We are mindful that as we continue through this period that we have to continue to have measures that will support vulnerable families. As such, Prime Minister Motley would have announced yesterday a series of measures that I will lead a team along with other members of the cabinet, including Minister Cynthia Ford, Minister King, Minister Cummins, Minister Cadell, Minister McConney, all of whom will assist in being able to help now to coordinate and put together the logistics to enable persons who are most vulnerable in our society to access what is perhaps a basic necessity, which is food and certainly produce at this particularly difficult time. Over the course of the last few days, we've been actually looking at sourcing a number of products, a number of basic food items. I think most of us, when we're distributing hampers, we have a kind of checklist of basic food items because we understand that, you know, many people may have the financial resources, however limited, to be able to add to whatever sometimes the Member of Parliament might be able to give to them. But we also recognize in this environment that we have a responsibility to make sure that you also have not just basic food items, but also that you have access to some agricultural produce, and in particular, things which at this point in time can keep you healthy. So as Minister Simmons would have alluded to, we're going to be working very closely with the Ministry of Agriculture and certainly all of the farmers in this country, and particularly where they may have excess produce after they have made arrangements with their normal suppliers to get rid of some of the produce that they have. The intention is that they will be able to take their produce to the packing house provided by the Barbados Agricultural Development Marketing Corporation, and they will facilitate the receipt of those items, obviously at a cost, and in turn we will have those items packaged and placed within the basket of goods that we will be distributing to vulnerable households. Now, how do we determine who are the most vulnerable households in Barbados? Well, we have gone through this exercise before, and I know that there are many persons who, in addition to the list that we may have from the National Assistance Board, also from the Ministry, the Welfare Department, and certainly the Household Mitigation Unit. There are other people who have crept into the fold of now being classed as most vulnerable in this country. And so we are starting the process of looking at all of the databases that are available to us, all of those persons who access resources through any of those mediums, any of those departments, they will obviously be given first priority. But then you also have those persons who may not necessarily be, as we would say, on the radar. Those persons who, because of pride or other reasons, are not generally the persons who come forward and say that they need assistance. I want to say to Barbadians tonight that just as Minister Simmons said, COVID does not choose its victim. It doesn't determine who it's going to rest upon and inflict based on what you do or who you are in life. Similarly, when it comes to feeding people as well, we have a responsibility to make sure that any person who needs assistance at this point in time is able to come forward. So we've asked our members of Parliament across the political divide, and that has also included not only the leader of the opposition, but it's also included the leader of the Democratic Labour Party, that we're asking their assistance as well, and we will be providing them with assistance to be able to feed persons who may not ordinarily come forward through all of our members of Parliament from the Barbados Labour Party. And we want to do that because we want people to appreciate that this really has no, our politics rather, has no place right now in feeding vulnerable households households in this country. So we will be working together with the various departments, the various government departments. All of the team will be coordinating the effort in terms of extrapolating all of the information that would allow us to know where people are across the country. We're going to be relying on churches as well to be able to feed some of that information into the exercise. And also we will be setting up a call center, because we want to make sure that just in case persons don't feel comfortable coming to the MP or going to an opposition person or to the church, that they have an opportunity to call and to indicate to the team that they have a need, so that we can basically meet that need for them as well. So we have started that process of compiling the goods. We are also going to be using the assistance of the Barbados Defence Force to help us to package. We're also going to be using the school meals centres to be able to assist us in putting those items together. And as I said earlier, also the Ministry of Agriculture through the packing house will also be able to assist us. So the expected time frame for the distribution is between the 9th and the 11th of February. We want to give people an opportunity, as you know, over the next couple of days to stock up on what they need wherever possible, but we recognize that by the second week, those stocks may be running low. Equally, your financial resources may be running low, and we want to put you in a position that at least you have something to be able to tie you over for the next couple of weeks as well. And of course, in all of this, it would be remiss of me if I didn't say that while our children are at home with many of their families, that I would want to encourage all of you to ensure that children are eating healthy. And I think that for me, this opportunity that is presenting itself with COVID is really a point at which Barbadians need to pause. If they have opportunities now to get into the kitchen garden, as I certainly have done in the last few weeks and months, I would encourage you to do so. Do a little backyard gardening, keep yourself occupied, and of course, ensure that you're getting up and doing some physical exercise in between. But it is important that while we are taking this time to pause, that we also stop for a bit and look at our eating habits. We look at the fact that we have people who have comorbidity challenges, and that we recognize that this may be the time to change your diet. This may be the time to put yourself in a position where when you come out of this, that you are better for it as well. So those are a few of the things that we have in the works in terms of the plans for the next few weeks. I will reiterate what others have said. This is not a perfect system. Along the way, we may not capture everybody, but we want to make sure that the public understands that there are mechanisms for making us aware as MPs and certainly as a government of the people out there who are in greatest need. I would obviously urge that, persons try not to abuse the system, because we obviously are mindful that you want to get to the people who really need the help most of all. But we are looking at about 60,000 care packages that we're going to be putting together. And of course, we will never refuse assistance from any entity that may be able to add to what we are already doing. So all of the charities, wherever possible, and they wish to assist as well, that is fine also, because I think that we've been carried quite a bit by some of the trusts over the last few months, but the Barbados government always has maintained that it has a responsibility to its people, and in particular to its most vulnerable people. So Ambassador, that gives you pretty much a synopsis of where we are and what the plans are over the course of the next couple of weeks. And I hope that in the next few days we'll be able to have the call centers set up, and we will have a line that you will be able to contact us to be able to give us some information on any person that you may think may not be, on our radar at this point in time.
Thank you very much, Minister, for the very careful information and explanation. Just let me share with you, for those who may not have heard it, the email address to which you should write if you think that you may not be known, or that your business isn't known, or you may be excluded, or you want to make some special case for recognition in some way, or for partial, or for funding. The funding that the minister has indicated will be available, $750 to shops. So $1,500 in all to shops, and vendors $500, $250 each over a 2-week period. So if I could just give you that address, please. It is commerce.smallbusiness@barbados.gov.bb. Let me spell it for you. because I know sometimes when we enunciate it's not clear. Commerce, C-O-M-M-E-R-C-E, dot, small business, S-M-A-L-L-B-U-S-I-N-E-S-S, at Barbados, barbados.gov.bb. commerce.smallbusiness@barbados.gov.bb. Let me just repeat those details for you, please. Businesses, your banking information is going to be required, the type and address of the business that you operate. So you operate a hairdressing salon at the corner of X Street and Y Road. The name of the business or the name of the owner or operator or both. Your banking information, so that government can provide this assistance to you. That is what the Ministry of Energy, Small Business, and Entrepreneurship is asking you to do. We have with us this evening members of the media. Mr. Randy Bennett of Barbados Today, Mr. Ryan Broom of CBC, Mr. Colville Mounsey of The Nation, Ms. Tanya Lightbourne of The Advocate, and Ms. Asha Cumberbatch of Loop News. Members of the media, we will now entertain your questions.
Hi, good night. I have a question for Minister Simmons. Are you here, Mr.?
I am.
Okay. In like manner that you would have indicated that you have a verification process through pre-existing registrations, whether through the liquor license, etc. And just to go over what you would have said, I think you mentioned you have around 1,500 liquor license and around 1,400 registered vendors. I am wondering if, in like manner, you have calculated or estimated the overall cost of this financial assistance through that benchmark that you would have set. And for example, based on the numbers that you would have just shared in terms of liquor license and vendor's license, that's already close to $3 million. So could you illuminate and shed some light on that for me, please?
It is correct to say that there has been some calculation. Obviously, as I pointed out at the beginning, I had my necessary meetings with the Ministry of Finance before we could embark on this recommendation to Cabinet. And I say to you, as the Prime Minister has said to us, we have to be sure that we are, first of all, spending the money sensibly. And so therefore, we can't afford to have people gaming the system. I think Minister Bradshaw just said it very correctly with regard to the care packages. There is a tendency, and we have to be candid among ourselves as Barbadians, there is a tendency in Barbados for some people who are not necessarily that much in need to want to put themselves in a position where they receive, and it is to the detriment of someone who is in far greater need. There's only so many care packages that we will have. Equally, it is also true of the financial assistance packages. There may be people who do not necessarily need, but they will try to put themselves in a position where they can get. And so we have to apply a measure of prudence in dealing with public funds. But then the other important point that the Prime Minister makes is this: you can't afford for people to die. And this is really what this is about. This shutdown is to protect life in a very real sense. And frankly speaking, I don't think once we have the financial wherewithal to accomplish it, I don't think that we can put a price tag on the lives of fellow Barbadians.
The Minister, while I understand that, yes, you can't put a price tag, but you do have a price tag. So is it okay to share that with Barbadians?
Well, I can't go any further than the ones that I have already identified, because in the couple of days available to me, I had the time for my staff to be able to do and I have to thank the staff of the Ministry of Commerce, the Department of Commerce in the ministry, because they would have worked to make sure that we knew exactly how many vendors we have. And if you understand the arrangement, vendors are not necessarily all licensed or registered with one entity. some with agriculture, some with National Conservation Commission, etc. Then the other thing that we were able to do is to identify or to trace the amount of liquor licenses, which gives us a very close to accurate estimate of how many people or liquor licenses we have out there. We haven't been able to do that across all of the different sectors as yet. So for example, if you were to ask me how many nail technicians there are in Barbados, I could not say so with certainty now. I'm hoping that within the next few days, I'll be in a better position to do that. Equally, we have an idea of how many water sports operators are operating, I want to say legitimately, but I could not tell you how many there are in totality at this stage. But effectively, what we are trying to do is to reach out to those businesses that we know about and to try to bring them into the net. But your question also allows me to raise another critical point that I want all small business people in Barbados to bear in mind and see this as an example of the way to go in the future. And I mean this sincerely. We can't help you in government unless you help yourself and put yourself in a position for us to help you. We need for people to register. Too many people in Barbados are operating under the radar. They're not registered with NIS, even though I think it is correct to say the minimum contribution you make in NIS is about $20 to $25 a week, but still not registering with NIS. They're not paying taxes. They're not part of the system. But then when we have a crisis such as this, or heaven forbid, as the Prime Minister often does, not would, with regard to a hurricane or some other calamity, you want government to be able to assist you. But government can't realistically come to the assistance of people we do not know about. And so therefore it is very critical for all of our entrepreneurs to take the time to make the effort. I know it is hard sometimes, but you gotta make the effort to try to become formally part of the system and not operate under the radar.
Good evening, Minister Simmons. Just one question. There has been, this particular initiative is geared at vendors, shops, small businesses in general, but there has been a consensus from restaurants that government could allow them to remain open for curbside pickup and for takeaway. Is any consideration being given to this option?
Yes, and I think the answer to that unfortunately has to be no. As I just said to you, it is with the greatest possible reluctance that government has come to this point. This shutdown is not like the shutdown that we went through in the earlier part of last year. And for the very real reason that I just gave to you, there is a tremendously greater degree of severity with regard to this strain that has been identified in Barbados. I don't say that to panic people, but I say that to be real. Minister Bostic began this press conference by telling us of 34 new cases. I don't know what the strain is, but I know there are 34 new cases. We know that over the last few days, we've had 3, 4, perhaps deaths. We know that we cannot treat lightly to this set of circumstances, and therefore there has to be a disincentive, a discouragement, for want of a better way of putting it. We need to discourage people from feeling that Monday, we're going to go by Kentucky, pardon me calling the company name. Tuesday, we're going by another company or wherever to get a drive-through and so on, because it's a little bit of spree time and you could be out on the road and enjoy yourself a little bit. The government is not hard-hearted. I should say to you that the last thing the Prime Minister told me before, or told us before we left Cabinet, was that she's agreeing to opening the beaches from 6 a.m. to 9 in the morning. But it can't, again, be beach picnic time. It can't be beach cricket time. It is go and get a little exercise and go along back home. And I know that every business, trust me, I am minister responsible for business. I would not come here and say anything that would stand in the way of businesses making money. But equally, I know that we will have no economy and we will have little or no business if we do not have a health system. And the health system of Barbados will be placed under immeasurable pressure and bearable pressure if we do not make the most of these 2 weeks to stamp out this invisible enemy that is amongst us.
And just one follow-up question. Sorry, Ryan, just one follow-up question. And some restaurants have also expressed some concern that during this 2-week lockdown period, that they will go out of business. They've said that they have suffered significant losses from the last lockdown, and this will be additional pressure on their businesses. Is there any help on the way for those restaurants or for maybe those larger businesses?
I think that a case will have to be made, and I would advise those people who feel they're in that set of circumstances to do a little advocacy and come to us and let us see what is possible and if it is possible. It is true to say that through the fund access and the trust loans, we would have lent assistance to hundreds of businesses in the aftermath of the last lockdown. I don't take lightly the challenge, but equally I have to proceed with caution, because even as everyone is making a special pleading, the reality is that government's resources are also falling. Tax revenues are falling because there is less tax take coming into the country or coming into the coffers of the country as a result of the declining activity. We know, and we've heard Minister Cummins make the point that 10,000 odd tourists would have been in the island over our winter season. I know of a winter season where we had in excess of 250,000. It just gives you an idea of what we're up against. So yes, everyone would want government to come and partner, and trust me, government would do its best. But the reality is there is a limitation on what is possible. And I think we have to face that reality.
Minister Ryan Broom here, CDC, just to go back to this issue of the village shops for a second, it seems, and coming out from some of the discussion, that the presumption of a village shop is that it's a village shop and bar. But what about those village shops that don't have seating facilities and so on? I know you mentioned that rural shops will be given priority in terms of operation. But what about those shops that don't have sitting facilities or a bar component and are not in rural Barbados? Would some consideration be given to them?
First of all, I use the term mini-mart, which is different from shop. And with regard to the mini-marts, yes, there will be in rural Barbados a priority given to them. With regard to the shop, I understand what you're saying, and I equally know in my constituency of a shop where if you go to the front, you're going to see nothing but that which looks like an ordinary shop. But the liming going to take place in the back. And there's just simply no way that we're going to find the human resources, and Minister Bostic is on this panel, you can, if you doubt me, talk to him. I don't think that this government has the human resources to police over 1,500 shops during the course of the next 2 weeks in order to make sure that lawlessness does not take place to the detriment of the wider society. And in a real sense, all of us know that during the last shutdown, if we want to be candid with ourselves, there was a lot of lawlessness that took place. I saw it with my own eyes. I remember seeing the meme going around with a man, you're not supposed to buy liquor, but the liquor being bought on the street off the truck. You know, those are things that happened. Don't laugh, Ryan, because you know it happened. And it just can't be risked again because of the danger that this current situation presents to the entire country, collectively.
Okay. Question from Minister Bostic.
Yes, please.
Yes, Minister Bostic. The first 2 of the 4 deaths that we just recently recorded, we had gotten some sense of contact. In terms of the first one, you had said that was linked to a non-positive case. The second one, you said, you said that someone had presented at the hospital and so on. For these last 2, I don't know if it's because we're now into community spread. No specifics were given in terms of whether these were new cases that came out or whether it was a case of cases that you had known already in terms of the deaths. Could you offer any or shed any further light on that particular thing in terms of the last 2 deaths that were recorded, if there were new cases that came into the fold, or if these were people who were already in the system and had been assessed?
Yes, these were people already in the system and assessed, and this was part of the contact tracing process where people would have been assessed, tested, some tested positive, and I know, for example, the last case would have been in isolation. So, yes, there's nothing else that I can report on the last two cases, but they're all part of the contact tracing process. The other two cases, of course, I would have reported. These would have presented to accident and emergency, and they're presented with symptoms, and after we received the COVID-19 test results, they had tested positive.
Mr. Mumsey, you are muted.
Yes. Yes, Carville Munsey from Nation News again. Minister Bostic, throughout this pandemic, you would have insisted on Fort Knox-like security at the geriatric hospital. Now that a patient, has tested positive for the virus, two things. Firstly, could you tell me what is the status of that patient at the moment in terms of their condition? And also, in terms of measures at that facility, given the vulnerability of those patients there, are there going to be further tightening of those measures on the cards?
Well, the measures that we had announced several months ago in relation to our hospitals, and in this case, the geriatric hospitals, those measures remain in place in terms of persons visiting, etc. And I will tell you that this particular case, this particular case had to be something that obviously the virus came into the hospital, and that is being investigated, because obviously if a patient is in the hospital for several years or several months, then they would not have had the opportunity to go on the outside. But our situation in Barbados at the moment, as it relates to our hospitals and our medical facilities, we have been impacted also by what has happened in the general population. But the vast majority of the cases that we've had involving medical or healthcare personnel really have been cases related to contacts within the community and not from within the hospitals themselves. This particular case is different, but I cannot give you any details because this matter obviously is being investigated through the contact tracing mechanism. But the first priority really was to try to get the matter managed so that we could contain any further cases within the hospital itself. And we've done that, as I indicated to you. We've tested all persons from that ward and all of the medical and ancillary staff who would have been associated or interacted with the ward, and all have tested negative with the antigen tests, and they're being processed now for the PCR tests.
But Mr. Bostic, that kind of validates the point I'm trying to drive home at. You would have had no visitation, yet somehow a patient managed to still test positive among a very vulnerable population. Don't you then think that there is a need for some further tightening to protect those persons given their vulnerabilities?
Well, we've done everything possible to protect our vulnerable population within the hospitals, as you can appreciate, and especially after seeing what was happening across the globe. We've done everything possible to prevent this day from happening or coming, but it is here, and we are dealing with it. The hospitals have policies in relation to even all staff members who come to work, just as you would have if a person's coming to work at your institution. And that is the temperature screening and the other things that we do. So that, however, would not pick up a person who is asymptomatic. And we do everything within the hospitals. The patients are checked, but this particular patient developed some symptoms, and then the hospital moved swiftly to ensure that the person was isolated and that the person was tested. And that is as much as the hospital could have been expected to do at that point in time. And we are following through with what we have to do in order to deal with the situation.
Just to alert that we are going to conclude in 10 minutes because we are trying to have our press conferences in blocks of an hour. They've tended to go on for very long times, and we're trying to be a little more organized and disciplined. So just to alert.
Hi, good evening. My question is for Mr. Bostic. As it relates to families who might have persons who suffer from Alzheimer's and dementia, during this time, what provision would be made for them? What should they do right now at this time?
I would...
Get them into the geriatric hospital.
Right. Your question sounded as though it was coming from a clinical perspective, which really would have been out of my reach, although I've learned a lot in the last 2 years that I've been in this job. But obviously, the policy in relation to admissions at the hospital, those policies, those protocols, those procedures remain the same, and those decisions are taken by the consultant gerontologist, who is very, very good at doing what he does. And those policies will remain the same. And of course, all persons are tested for COVID before they're allowed to come into the hospital. So I expect that policies will continue along those lines.
Okay, thank you. I also have a question for Minister Bradshaw. Hi, good evening. Given the recent curfew and the upcoming national pause, is there any consideration being given to UE students in relation to their volunteer hours for the Give Back program?
Well, thanks for the question. We've had a lot of challenges, as you could appreciate, since the early stages of the lockdown with the Give Back program, primarily because a number of the charitable organizations, a number of the entities that would have signed up to facilitate the students, many of them have a lot of elderly persons as well who are part of their entities. And as a consequence, we had to suspend at one point a number of the activities. We're seeing again in this environment, obviously some challenges with students being able to continue to engage in the number of hours. But we have always taken the approach that, we encourage the students to participate. We encourage entities to get on board. But in a COVID environment, it's not a perfect situation. So there is going to have to be a situation now where, as Prime Minister keeps saying, we need to pause. Right now, we need to save lives. So as much as we want to encourage Give Back, I've said to a number of the students, just hold for a little bit. As soon as we can pick back up, the activities will still be there, but we are guided by health first and foremost. And this is a very difficult period for the entire country, but that's why we're asking Barbadians to really pause, and that includes our students across the entire system as well.
Will there be an extension then from July 31st, or are you going to stick with the July 31st deadline to complete the hours?
You're talking about the students who have just come onto the program?
Yeah.
Yes, we will extend where possible, and I suspect that as we continue to monitor what is happening in the country, we can make some changes accordingly. But I don't think that I can say what will happen, in July. I think right now we want to get through the next 2 weeks, and we really want Barbadians to give us the best shot at being able to wrestle this situation to the ground. I think once Bajans appreciate what is at stake, I think that they will understand that there are some things that are just not going to be able to happen right now, and that includes Give Back, that includes full face-to-face for students to go to school, that includes vending, that includes restaurants. There are just some things right now that we have to pause and basically put ourselves in a position that we can deal with this virus head-on.
Okay, thank you very much.
I have one question for you, Minister Bradshaw. You would have met today with officials from the BUT and BSTU regarding online education. Would you be able to give an update on those talks?
Yes, we met this morning. I feel as though you have been eavesdropping because I had a meeting with them only this morning. BAPS, APS, BSTU, and BUT, as we would normally do in this, particularly in this environment where we try to solicit views from all of the stakeholders. I think everyone is agreed that it is a difficult time, but we all appreciate that we don't want to have children continuing to fall behind, and so for the most part, everyone is committed to making sure that we do the right thing in keeping our students in an online environment if that is what the situation right now dictates. I'm grateful to all of the teachers and the principals who've been working really, really hard over the last few months to really kind of grapple with technology and including that in this classroom environment, because they've been thrust into this environment through no fault of their own, but they really have been embracing all that we've been trying to offer to them in education. And I know we have the support across the system of those teachers who just don't want to see children who were falling behind before fall behind even more during this difficult period. So I think it's fair to say that there is consensus in relation to the way forward. We have some teachers who've been working at the schools, as you know, because they may not have access to devices. We're still working on getting all of the devices onto the island, and that process is ongoing, as you know. But many of the devices have already been distributed to the ITCs. We've had to configure them. We have a couple more that are coming into the island. So over the course of the next few days, and certainly even during the lockdown, the anticipation is that we will have all of the devices configured and be able to distribute to students and to teachers who may not have devices at this point in time. One other issue that I'll just put on the table is that obviously there was concern about what happens at the schools in relation to this particular period. I think people can appreciate that there'll still be a skeleton staff because we have to protect our properties in terms of security, and we also have to ensure that the premises are still maintained as well. So principals will work with the ancillary staff to ensure that those who may have comorbidity challenges, that those persons are obviously taken out of the rotation, and perhaps other younger persons without any challenges can certainly fill in for them. And we've also tried to ensure that, if wherever possible, persons can work remotely during this particular period of time. So I think generally we are agreed. If we are not usually agreed, I think on this occasion we are agreed for the most part as to how the next 2 weeks will look.
Good evening again. I see that Dr. Corey Ford is on the call. Dr. Ford, are you taking any questions?
Yes, good evening.
Hi, good evening. I just wanted to know if there is anyone in critical care, anyone on a ventilator at this moment.
Yes. So we continue, good evening, Barbadians. We continue to ask Barbadians to work with us and pray for all of our citizens who are currently in the critical care unit. At present, there are 10 persons in the critical care unit. One of them is on the ventilator. Unfortunately, one of those individuals is one that the minister spoke about, who was in facility, who was on a ventilator, a Barbadian female with some comorbidities, who unfortunately passed away. And we have one other person who's currently on a ventilator. There are 8 persons in the facility who are currently on oxygen support, and they're all Barbadian nationals. The one on the ventilator continues to be the Trinidadian national. And she has shown some improvement in her situation over the last few days, and we really continue to pray that this continues to continue in that particular vein.
Thank you.
Mr. Ford? Dr. Ford?
Hi, good evening.
Hi, good evening. Could you give an age range of the people who are in the critical care section right now? The age ranges.
Okay, great. So the ages in the critical care unit is aged between 42 years old and 72 years of age at this particular point. As of the time I was on this call, that might have changed, of course, but at the time of this call, that's the particular age groups. Of course, I would say caveat to that is that we've had younger people in the unit in recent days, which really speaks to, I think, what what we've been saying all along, that this disease is certainly no respecter of age, certainly no respecter of persons. And I think what it really means for us as Barbadian nationals is that we really need to heed the calls that the Ministry of Health has put out. Physical distance, hand washing, and wear your mask. I continue to see too many people. Every time I see people on the road and they're together in bunches, not wearing masks, it almost sends the chills to me because it puts a real strain on our healthcare system. People look well and they're walking around. They look like me or you, and they may have the virus, but it may not be necessarily them. They're the persons who might not get in trouble, but it might be their granny who's in the house. It might be their mother. It might be their father. It might be their neighbor. I am really, really asking, because of what we've seen over the last few weeks in our intensive care unit, managed by Dr. Lovell. People are presenting more sick, or we're getting more sick people. Okay, and I'm really asking Barbadians to heed the warnings. As we go on other ways to figure out other people who are maybe ill, I'm really asking you seriously tonight to heed the warnings of the Ministry of Health. And as we go on the lockdown, I'm also asking to take time with your family as well, but also heed the warnings and really follow the protocols. This is strategically important. If our healthcare system crashes, it's not going to be very easy. I think a lot of the physicians are under a lot of pressure right now, trying to keep things in order. And you are the only people out there who are going to help us to do that in the long run.
I know we're running out of time, so question for Minister Bostic really quickly. We're hearing reports of some bogus vaccines in circulation in the region. Have you been getting those reports, and what are we doing to safeguard and ensure that nobody is either duped or whatever this is, whether citizens or anyone else, by these bogus vaccines that seem to be in circulation?
No, I'm unaware of the report, but I can tell you beyond a shadow of a doubt that we follow, as we've been saying for almost a year, that we are guided by the World Health Organization and the Pan American Health Organization, not only for vaccines, but tests, rapid tests, and in several other areas. So we are confident that, and we are part of the COVAX facility that we have spoken to on other occasions, and we're very confident that whenever we have vaccines in this country, that they will not be bogus vaccines, but I do not know of what you're speaking to at this point in time.
And finally, the current curfew ends on January 31st, and then the new measures go into effect on the 3rd. What will obtain in that interim period between the 31st and the 3rd in terms of the curfew conditions?
The question?
Curfew is scheduled to end in 9 to 6 on January 31st, and then the new conditions, the new lockdown conditions come into effect on the 3rd of February. What will obtain in that interim, those few days, those couple of days?
I think it is fair to say that we are still in a state of emergency, and obviously at the point where we have evaluated whether we have met the targets, at that point I'm sure Prime Minister Motley will speak to the country again, and certainly Minister Bostic and his team. But the key here is not so much to look at what happens at that point. I think the message really to Barbadians is that you have to stay put over the course of the next 2 weeks, and you have to do it not just for yourselves but for all Barbadians. As Corey just said, we cannot take the pressure on the system, and therefore we are where we are, but we don't have to stay where we are. And therefore the appeal really is to Barbadians to just take heed, to consider not just yourselves, but consider your families, and look out for the other elderly in the community, and just make sure that you're doing the sanitizing, washing your hands, and keeping your distance from people. So it's really not so much about what happens at the end of it. We need to get through it first, and then we will come back to the country as to what we do next.
Thank you very much, ladies and gentlemen of the media. Deeply grateful to Ministers Bostic, Bradshaw, and Simmons. I'm sure that there will be a lot of people discussing Pearl tomorrow. Before we go, let's repeat the key messages that we got today. Dr. Ford was very, very clear in his emphasis that we need to exercise care and caution with each other, particularly within the context of the family and people to whom we were close. He asked that people continue masking up, washing up, and moving away from other people. 6 feet is the distance that is recommended. We know that there is a plan in place to protect the elderly, vulnerable, and the poor as we go into our period of pause. There are resources and compensation available to vendors and the owners, operators of shops. If you have a small business, a shop, and you don't think you have been included in the plan, you are to to write commerce.smallbusiness@barbados.gov.bb, and in that email, you are to provide the name of the business or the name of the business owner or operator, both, if you wish, the type and address of the business. So, for instance, you have a tire shop at Redmond Village in St. Thomas, your banking information, and the government will indicate what is the provision that has been made for you. But the plan is that shops will get $750 per week of $1,500 in total, and vendors will get $250 per week or $500 in total. It is also proposed to assist other types of businesses, particularly those that are female-owned and operated, salons and nail technicians, but we are not leaving out the water sports operators, barbers, taxi operators, and vegetable farmers. In that regard, Minister Bradshaw indicated that government is going to be purchasing vegetables and fruit to put into the 60,000 care packages that are to be distributed to vulnerable families and to persons in need to ensure that they can have wholesome diets and that children and the elderly in particular are eating healthy foods. She indicated, I believe, that distribution will be on the 9th and 10th, Minister? 9th until the 12th. From the 9th until the 12th, the distribution period will follow. Families are going to be supported. They are not going to be left alone. The Barbados Defense Force and other agencies are going to be engaged in the packing and the distribution exercise. More details will follow. And beaches, for those who want to exercise, not to have picnics, lime, and hang out, but for exercise, beaches will be open from 6 a.m. until 9 a.m. The issue of vaccines came up. We will be having a program on vaccines. Equally, we are going to have a conference that will deal with the issue of the community intervention, which government has spoken to. The Prime Minister spoke to it in her address. The Seek and Save every single vulnerable Barbadian. We're going to talk more about that in the next press conferences and the coming press conferences. Those are this evening's core messages. It really is up to all of us to do the right thing. Wear your mask right. Wash your hands often or sanitize. Don't stand too close to other people. Be careful with those you love, because they're the ones who, if you get sick, they're the ones who you are going to make sick, even if you don't break down yourself. But most of all, emerging from today's discussion is the very clear message. There is a plan to address what is happening. That plan is being rolled out. It is being explained to you so that you are familiar with the details. The people of Barbados are going to be supported through this, supported financially where necessary, supported by being given information, supported by being given access or further access to members of Parliament and the professionals you need to help you during this period of pause. We can, working together, doing the right thing, beat back COVID. Good night to you.